which foods contain glucosamine, and can diet support joint health? Have you ever wondered whether you can get glucosamine from food alone? The short answer is not really, and here's why that matters for your joint health. Glucosamine is a naturally occurring amino sugar that plays a key role in building and maintaining cartilage, the cushioning tissue that protects your joints. As we age, the body's natural glucosamine production may decline, which is why so many people look for ways to top it up. But when it comes to getting it from food, the picture is more complicated than you might expect. So where does glucosamine actually come from in nature? The richest sources are shellfish shells, think prawn, crab, and lobster exoskeletons, along with animal cartilage and bone broth. The problem is that these sources contain glucosamine in a bound form that's very difficult for the body to absorb through normal digestion. And of course, shellfish shells aren't something you'd actually eat. So while these foods do contain glucosamine, the amounts you'd realistically absorb are trace at best and impossible to quantify reliably. What about plant-based sources? Here's something that surprises a lot of people. No plant-based whole foods contain glucosamine. If you follow a vegetarian or vegan diet and you're looking at glucosamine supplements, those are typically derived from fungal fermentation processes rather than shellfish. Now, this is really important. Nice. The National Institute for Health and Care Excellence updated its guidelines in 2022, and those guidelines advise against offering glucosamine for the management of osteoarthritis. Instead, the evidence points to treatments like exercise, weight management, and appropriate pain relief as the recommended approaches. So, if joint health is a concern for you, those are the conversations worth having with your GP or rheumatologist first. That said, glucosamine products are widely available in the UK as food supplements, and some are licensed as medicines. It's worth knowing that food supplements don't go through the same rigorous regulatory approval process as pharmaceutical medicines. The MHRA monitors safety, but it doesn't evaluate the effectiveness claims made for supplements in the same way. Clinical studies use standardized supplement doses that are far higher than anything you could obtain from food, but we won't go into dosing here as that's a conversation to have with your GP or pharmacist. If you're thinking about glucosamine, there are some specific groups who need to take extra care. If you have a shellfish allergy, check the source of any glucosamine product carefully before taking it. If you have diabetes, speak to your doctor before taking glucosamine, as it may not be suitable for everyone. And if you're taking warfarin, research suggests there may be an interaction. So again, that's a conversation to have with your healthcare professional before making any changes. Never adjust your prescribed medication without speaking to your doctor first, and always let them know about any supplements you're taking or considering. So to recap, glucosamine does occur naturally in some foods, but dietary intake alone simply cannot provide the amounts found in supplements. Current NICE guidelines don't recommend glucosamine for osteoarthritis, and the focus should be on evidence-based approaches like exercise and weight management. And if you're in a higher risk group, shellfish allergy, diabetes, or taking warfarin, always check with a healthcare professional first. This video is for general information only and is not a substitute for advice from your GP or pharmacist. If you found this helpful, drop a comment below. We'd love to hear your questions. And if you haven't already, please do like this video and subscribe to the Bolt Pharmacy channel for more medically reviewed health information explained clearly.